To our Facts Not Fear coverage of COVID-19 tonight, Ohio's case numbers quite concerning. Good evening. Thanks for joining us at 11. I'm Andrew Kinsey. Yolanda has the night off. Take a look at today's numbers from the Department of Health. We saw more than 8,300 new cases today, which is the third day in the past week we've had more than 8,000 new cases. Our positivity rate, 13.4%. Look at those hospitalizations there. We had 355 new patients today. Our moving average and for hospitalizations looks like this. You can see we're averaging about 225 new patients a day and increasing. And according to the state's latest data, there are now more than 3,500 COVID-19 patients in Ohio hospitals. So today, the 4 major hospitals here in Columbus wrote a letter pleading for help. They don't have enough beds if this keeps up. New tonight, 10 TV's Olivia Eugenio spoke with one nurse about what she's seeing there on the front line.
Exhausting.
We think of superheroes as invincible.
It's just taxing. It's very taxing.
But heroes like Wengi Arter are still
I have no words.
human. Arter works as an ICU nurse at OSU's Wexner Medical Center.
We're always full. Beds are filled. As soon as, we discharge someone, then that bed is, the turnaround is probably a couple hours.
Arter estimates at the beginning of the summer, about 5 of the hospital's 48 ICU beds were filled by COVID patients. Now she says that number is 22.
You're by yourself in there with this patient, with this person who has nobody around them.
This is the letter the CEOs from Mount Carmel, Ohio Health, Nationwide Children's Hospital, and OSU's Wexner Medical Center, asking anyone who needs care to consult their primary care provider first.
Instead of utilizing the emergency department as that first line of defense, work with your primary care provider. Oftentimes, your primary care provider can utilize telehealth, so it's very convenient.
In Franklin County Thursday morning, out of the 2,300 medical surgical beds, only 11 were open. And of the 560 ICU beds in the county, just 10 were open.
This is the highest that I've ever seen. In my 13 years of working with the local hospitals, I've never seen capacity this tight throughout the pandemic and beyond.
Another way you can help is if you need a COVID test but you aren't showing any symptoms, instead of going to an emergency room, go to your local pharmacy. Olivia Eugenio, 10 TV News.